Hi everyone, this is Dr. Nagen Reddy, consultant endocrinologist, Jakka Diabetes Endocrine Center, Vanastaripuram. So today I am going to present a case example. This is a classical case you see in your day-to-day practice. So 60 years male patient with history of type 2 diabetes since 4 years. So with the obesity, hypertension, hyperlipidemia, obstructive sleep apnea. So his BMI was 32 kg per meter square and other vitals are stable. So currently he's taking metformin 1000 mg twice daily along with the antihypertensives and atorvastatin 40 mg once daily. So on laboratory evaluation is A1c 8.9 with GFR 75 with LDL 69, HDL 35, triglyceride is 250. If you see such type of patients in your day-to-day practice, so what we will do? For this patient with the uncontrolled diabetes, the maximum dose of metformin. So what is the best line medication after second line medication for this patient with the multiple comorbid conditions? So we have to keep the A1C less than 7 as per the ADA recommendation. So while avoiding hyperglycemia. So to summarize, this patient history is a obese patient with the multiple comorbid conditions with the uncontrolled diabetes. So for this patient, we should have a medication which will control the glucose levels with the other preventive benefits like reduction of weight and reduction of the cardiovascular risk. So we have the drugs like the empagliflozin, which have proven cardiovascular benefits, reduction of the three-point MACE as well as the hospitalization heart failure. So with the cardiac benefits and renal benefits, so particularly for this patient with metformin and controlled diabetes. So here, do you think empagliflozin alone can decrease the A1C less than 7, or we go for the combination therapy? So here we should go for the combination therapy because the A1C is 8.9. So empagliflozin or the linagliptin alone may not achieve the target of A1C less than 7 or any other gliptins. So for this patient, we have given fixed dose combination of empagliflozin and linagliptin, so along with metformin. So over the period of time, is A1C came down to less than 7. So why we have to prepare the fixed dose combinations? So FDC advantage is we can decrease the pill burden, or we can decrease the complexity of the treatment regimens. So fewer pills, it will improve the patient adherence and compliance to the medication. So thereby we can achieve the good glycemic control, especially with particular regimen of metformin and the combination of empalina. So we can avoid the risk of hypoglycemia. At the same time, we can achieve weight loss and improvement of the some improvement in the BP. So as well as there are some studies have shown that there is improvement in the obstructive sleep apnea also with the use of empagliflozin. So shall we give the empagliflozin linagliptin separately or with the combination? So with the combination pills, we can improve the compliance by decreasing the pill number, pill burden. So what the evidence we have for the empagliflozin, though we have very important landmark trial, that is EMPIRIC outcome trial, which has shown that there is improvement in the cardiovascular benefits with the use of empagliflozin. So particularly the patient with the multiple comorbid conditions, with the high risk for the cardiovascular disease, obesity, hypertension, dyslipidemia. So these patients are the ideal patients for the giving the combination of empagliflozin and linagliptin. So if the patient is not under control with the metformin, the maximum tolerable doses. So thanks for the hearing. This is a one case example, and of course the approach is patient-centric. So if the patient depends upon the patient, comorbid conditions and duration of diabetes and severity of hyperglycemia, the patient affordability and the stage of CKD, and the patient is suffering with the heart failure. So or the cost effectiveness of therapy and compliance to the medication and risk of hypoglycemia. So all these parameters will influence to make a decision, but for the add-on therapy. Thank you. Thank you, one and all.